So, okay, I hope you had an opportunity to see the agenda for today's permanent commission in child care. And today I have the pleasure to share the agenda with Senator Lana DiMario. She will help me to go through the agenda so that way she start empower herself to lead in the meeting sometime. That way also I'm able to take break because since 2008 I never have any break. So Lana, be ready because I will take the opportunity of having you in the committee. So today I would like to welcome all of you and I would like to find out if we have any person who's joined us for the first time. Is anyone came to the meeting for the first time? That way we can make a noise. Is anyone? No? Okay. It is awesome. So at this point, I would like to provide some legislative updates. I know Leon Barrett was working with Kendra to identify some bills that was introduced since the last time we met in February. And Kendra, I see Kendra now join us. Kendra will be able to share the screen and to show us the legislation that was introduced in February. Kendra? I hope she's on. I see the name. While Kendra is ready, Leon, do you have any legislation that you wanted to make comments while we waiting for Kendra?
Well, I helped a little bit. So the big bill, I don't have the numbers in front of me, is Rep. Diaz's bill, and Senator Khanna was the sponsor on the Senate side. It's the Rhode Island Child Care is Essential Act, which has three components. So it's raising the rates, even above keeping the temporary rates, making them permanent, because that was a big increase, but making some additional increases, particularly for the preschool rates, which were not raised to the 75th percentile, and they need to be, and to add an infant bonus, which has been something Khadijah has brought up at least 2 or 3 times a year for the past 5 years. So to add a $20 weekly bonus for infants under 18 months, because they do cost more to serve, and that would provide another incentive for programs, because we really don't have enough high quality spaces for infants. So that's component 1 is rates. Component 2 is co-pays. We haven't had that in there before. So co-payments would be to cap co-payments at the federal affordability standard. We have a very clear guideline from the feds, which is no family should pay no more than 7%, but we have families who pay 10% and 14% in law. Right now, the state has waived co-pays, but in statute, it actually doesn't say what the limit should be. It just says there should be copays. So this would put a cap, and they can certainly have lower copays or waive them, but they couldn't do anything more than 7%. And the third thing is to restore eligibility back to where we were in 2006, which was at 225% of poverty, and to move the exit. Remember when we got the exit thing up to 225, so families could stay in up to 225. Now they can come in up to 225 if this passes, and stay in up to 300% of poverty. So all of this is really exciting, and with the new federal money coming in, we really think there's a strong chance that it could pass. A lot of states across the country are making big, bold action in childcare, and certainly Rep. Diaz has been, just like a dog on a bone about childcare for more than 10 years, as have many of us, and we really want to see this 10-year anniversary of the Child Care Day and have some big wins this year for childcare. So if that's a good summary, I think, of your bill, Rep. Diaz. Is Senator Cano on yet? I joined a little late. She's not on, is she?
I am. Sorry, I just got in.
Oh, you are? Okay, great.
Welcome. Welcome, Senator Cano. We're happy to having you in the meeting. We appreciate it. And even better, partnering with you for this important bill. And waiting and hope that we can move this bill soon and effective. So, Leon, thank you so much for the great update of the Senate and the House bill, the Senator Cano and myself, and I guess Senator Di Mario also signed it to introduce the bill. And welcome, Justin Caldwell. Hi, Justin. Welcome to the meeting. Be happy to
Hi,
see
thank
you.
you. I
Yeah,
was having connection issues at the State House, but Nick
yeah.
checked it
Sometimes that happens. That is why I give it 2 extra minutes to wait for people. Um, If there is any other state legislator that I'm not aware of, please help me to welcome because I don't want to miss anyone. And Kendra, are you able to share the screen now with all the bills you find? Uh, so we lost,
Representative,
yes.
Kendra is having some technical difficulty. That's why you can't see her right now. We're fixing it, and I'll let you know when it's all done.
Okay, no
Yeah, so
problem. I appreciate
thank,
the update. Yeah,
thank you.
thank you. We move the update for legislation to the bottom of the agenda so we can give her some time to update or fix the technical issues that she may fix them. Is any member of the commission knowing or aware of any legislation that we need to talk about it, concern, working, advocate? Is anything that you know that is happening? Because Sandra and the Senator Sandra Cano and Senator Di Mario, we agree with me that there are too many bills introduced every day, and it's hard to keep up on the bills. And look at Leon, agree with me too. And if somebody across to a bill that they feel like we need to talk, we always have a update legislation items in the agenda. So there is opportunity to bring those issues in front of the Child Care Commission. As a reminder, the Child Care Commission is a body to work in the legislature and the Senate to advise and advocate for child care bills, legislation that we are helping families in the state of Rhode Island. And also advise on bills that may affect the well-being of the children in reference to what the Child Care Commission did. So keep that in mind. This is a great opportunity to have the Child Care Commission behind or any things that maybe be a concerning situation. And at this point, because it's related, I want to ask Anne Mary Barr if she have any update about the proposed cut for the pre-K or kindergarten that we mentioned last meeting.
I do not have any updates. Now with the change of administration, we're just kind of waiting and to see what will happen with the budget.
2 weeks ago, we received the book for the 21-22 proposed budget. I didn't see nothing yet, but we asked the fiscal group, the fiscal analysis staff, to identify anything in the budget that we may need to be aware of, or in case somebody need a book, I'm able to give it 2,000 pages to read it. Do you want to grab a cup of coffee and read the book? It'd be awesome. So I have an option for you in case you need it. But and to take a shortcut of the process and find out, I think I need to speak with Sharon from finance. She's a book walking person and very knowledgeable of budget. And she will be able to tell me if there is anything that we need to concern or to work. And Kendra can help me with that because she go to the state house every day. So is there any update for legislation or any idea that you feel we need to talk and introduce a bill? Again, that's an opportunity. I see my policy advisor, a smart lady, Leon Barrett, raising the hand. So, my good
Well,
friend, Leon.
and I know Kendra's working on this. I opened up what she sent that I worked on. I don't think I can share though. Am I allowed to share on here?
No, because Kendra's here.
Oh,
Oh,
Chair, I am so sorry. I don't know if you can hear me and see me. I was having some technological issues. I called the tech department and I had to switch locations. So I apologize.
We understand. Now we depend on Zoom and WebEx and everything, and when those fail, we done.
I'm
We
so
understand.
sorry and thank you, thank you.
So I also have the list of the bill. It was sent it to the members when we send the invitation, and I was hoping that she can share that, but because she has some issues, um, Leon want to read some of the bills and help us.
Sure.
Leon?
Sure. And so the Early Educator Investment Act, I think we talked about at the last meeting, but that is Rep. Casimiro and Senator Cano's bill from last year, which would set some goals for wages for early educators, including childcare, EI, home visiting. Oh, here we go. So I don't have to. So anyway, that is there. I don't think we probably need to spend a lot of time on that one. There were hearings that were good, and we got really positive feedback from Chairman McNamara in House Education that he heard very glowing testimony. So you'll be on the lookout for that. I thought it was worth. There was a bill in here that I didn't know a lot about that I thought was worth talking about, which is the, oh my goodness, hold on. It's the one Ranglin Vassal did on, trying to find it right now.
Is 5932 and it's
Yes, 5932 authorizes both parents to seek financial child care benefits for their children rather than restricting it to the custodial parent. So I don't know a lot about this problem, but it must be a problem that somebody brought to her attention. So I didn't know if it's worth talking about in the commission to see if a lot of families have trouble with that and if it's something that we could easily fix through legislation.
Okay, let me speak with her to see the genesis of the bill. What is the motivation or reasons why she introduced it? Sometimes it's something simple or can be addressed administrated because I don't see why we have to put all the parents in that situation. But I promise Leon and the committee to speak with her this afternoon. And I will make it my little notebook here to add her some reference information about the bill.
Yep.
Kendra, we're not able to see the list yet. But anyway, Leon, is there another bill that you want to raise the alert or attention?
Sure. Well, I can just quickly go through. So we talked about early educator investment. Another one on here, which Rep. Casimiro has talked about, is the $2 million request for after-school summer learning and workforce development for, these are school-age kids who are, and that's been introduced on the House side. I don't think there's been a hearing yet, but that would, help a lot of our after-school providers would probably be eligible for that if that goes through. There's a bill from Chairman McNamara, which has come before the General Assembly several times. It's called the Early Childhood Innovation Act, and that's $1 million for infant and toddler programs that DHS would be in charge of funding. And so that has come back again. There's a new one from Rep. Williams, which is using the tax on the, I think they're called the compassion centers, the marijuana, it would be marijuana revenue, would go towards funding distressed community child enrichment programs, which again sounds like an after-school funding stream that would be set up to be targeted at our lowest income communities, and a process for distributing the funds with a focus on science, technology, engineering, and the arts, 75%, and 25% other, I think.
I think that is a good bill to get attention from Reg Casimiro because she's sitting in the after school commission, and that would be a good document to read and to see how she can benefit the population she's representing.
Yep, it seems kind of similar, but different, a little bit different than the $2 million ask. And the campaign bills, which are Rep. Caldwell's and Senator Golden's, which are is really kind of a way to help more parents who have kids be able to run and serve in office effectively, but to be able for elected officials to use their campaign funds to cover the cost of child care expenses. And I think there's already been a hearing on one of those. I don't know if Rep. Caldwell knows more than I do.
So we had the hearing in our new Municipal Government and Housing Committee on my House bill. It went really well. So I will check in with Evan Shanley, who's the chairman of that committee, about it, because it did pass in the Senate last year and not the House. And so I'll check in with Evan and see what we can do about moving that forward. It had a lot of support from the committee, no one opposed. So hopefully we can move that along.
If the members agreed, Red Caldwell, we able to write a letter of support from the Child Care Commission
Oh, that would be wonderful, I think.
to push a little bit more to pass the bill.
Yeah, that would be great, because the easier it is for parents to run, the stronger we'll be as a commission, right, in the House and the Senate. So yeah, thank you so much.
So let's chat this afternoon before or after the session about it, okay?
Okay, thanks, Chairwoman.
You're welcome. Thank you for your hard work on this issue. Is there more information, more bills to talk, Leon?
Yep, I can there's several that are relevant or partially relevant, although they may not specify childcare as much, but there's 5699, which is Rep. Williams. I think it's a new bill this year. It's the Increasing Opportunities for Teachers of Color Act. And since we do have so many teachers of color who are working in the childcare field, this would provide a scholarship fund and support for, advancing their careers. We obviously already send a lot of great teachers into K-12. So this could, be a great opportunity for some of the teachers in childcare to potentially become K-12 teachers. And we could also talk about how do we keep our really good teachers in early childhood, because we do have a very diverse group of teachers, and we would like to keep our good ones. The only way to do that is to improve compensation and benefits. So it just seemed very relevant to me. And the next one that's also relevant, also by Rep. Williams, is setting up a board to oversee career and technical education in Rhode Island, and childcare in lots of states, including in Rhode Island, is something you can get trained on in high school, and you can come out of high school with like a CDA or an entry-level certificate. It's not a high-paying job, so it's often, not necessarily seen as a extremely desirable track for people to go into. But there's a lot of high school kids who really like kids, and they can start there and they can move up to additional degrees and become a teacher. So it just seemed interesting, and there's more focus and attention on career and tech, and we should just keep our eyes out for how early childhood education fits and childcare fits into that career and tech training system that starts in high school. And I'll just keep going. There isn't one on both the House and Senate side. It's Rep. Morales' bill on the House and Senator Oyer's bill. And this one does specify childcare. And I thought a lot of the providers, there's only one. I'm combining them. There may be one on the Senate side, but it's Rep. Morales' bill on the House side, and it requires hazard pay for essential services, and childcare is listed in there.
A duplicate bill or a similar bill?
There are two different bills. I thought there was a Senate bill, but they're different. So the Senate bill is they're both minimum wage bills. So 5721 is a hazard pay bill. I think it requires that employers pay their workers 1.5 times or 1.3 times. I can't remember. I don't have it open in front of me, but it lists certain parts of the workforce that are determined essential. So it's totally related to the pandemic, like the fact that a lot of people who are low wage are required to work during a health emergency, and they should be ensured that they get better wages. So that bill is something to be aware of. And the next two bills are the companion bills. So Senate Bill 323, which is Senator Oyer's bill, and House Bill 5263, which is Senator Williams' bill. So Representative Williams. She has a lot of bills this year. And that allows individuals, so I don't know if people know this, but in our wage and labor laws for Rhode Island, if you work in or about a private home, you don't have to follow wage and labor laws. So
Wow.
technically, like family child care providers, or if you hire a nanny, other kinds of child care workers who work in your own home or in their private home, they're not, they don't have to have lunch break. They don't have to have minimum wage. There's other people who work in homes who this applies to as well. So they are proposing that we take that out of our wage and labor laws and say that if you employ somebody in domestic service, which includes childcare, in your home or in that other person's home, then they need to be treated as an employee and follow all the Rhode Island wage and labor laws.
So, stop 1 second there. So, home licensed childcare providers then need to follow that law?
Yes, if this changes. I think right now they might be exempt. There's other groups exempt, that are related to childcare. And if you employ a family member, your family members are exempt. So you don't have to, if you hire let's say your mother is your assistant, you're not required to pay her. Family members are exempt, or if you hire your adult child. So that would stay. But if you hire, an unrelated person to work for you as an assistant, you would need to follow the wage and labor laws, I think. I'm not a labor attorney, but that's how I read it.
Can I ask you something, Leon? I always overprotect the child care centers and licensing homes. I would like to know more and deeper about how the bill will impact on child care family home and centers, because we don't want surprises and then have to embark on more expenses for those businesses, especially during the COVID emergency situation. I don't want it to see we advocating because the bill is not good for us. I wanted to know that ahead, that way we can speak with the sponsor maybe and explain the points that we have or we think is some concern in the legislation. So helping us with that. And keep in mind that the General Assembly, House of Representatives is moving agenda so quick this year. We already having public hearing for most of the bill. So in any moment, the bill can go to the pipeline, and then I don't want to find ourselves behind or in the situation that we can do anything.
Yeah, I agree. And I would think the Family Child Care Union would, be interested in working on this and understanding it as well. The other, I was digging into this a little bit actually when I was writing my family child care policy brief. The other big group of child care workers who are exempt from minimum wage are people who work at summer camps. Summer camps are not required to pay minimum wage, which I did not know. I thought was interesting. So even though the minimum wage is so, not livable, that we have a lot of people in this field who make less than that.
Wow.
So it was just interesting. I mean, that's not a bill that's being proposed, but I thought I'd bring it up because I was digging into it, because a lot of family child care providers don't make minimum wage themselves, because they don't have enough kids and they work long hours, and it just continues to highlight that fundamentally we have a huge compensation problem.
Okay. Thank you, Leon. Is there any last bill that you want to bring our attention, because the time is running and we have session and I try to keep the meeting within the time. Is there any other bill that we need to talk and remind you that the members have a copy of this list of the bills too?
Well, the only other two that Kendra and I found, she found these, and I had seen them too as well, was the parking for people who have strollers, so which is kind of a fun bill.
Oh,
So you can look at it more, but it would require stores and stuff like that to provide special parking spots for people who have little kids, which is kind of fun. I don't know. It's not something that we've been working on. And then there's it's almost like a ledge grant for Inspiring Minds, which is on here, which is an after-school program in Providence.
Who introduced that one, Leon? I'm sorry to interrupt you. Who introduced it?
The one for Inspiring Minds?
Yes.
Somebody in Providence. I can't remember. Kendra, can you go down to that one? I think it's like the last one, possibly.
I think that in the Senate was Senator
Morales, that's the one. 6027.
Okay. $50,000 for Inspiring Minds. What does it mean? That we charging the business if they don't comply with that?
No, they're a nonprofit that they used to be called Volunteers in Providence Schools. I don't know if you remember them that way. They work with they work in school, but they also work after school and during the summer doing tutoring and academic enrichment. It's like an after-school summer program. They're not. I don't think they're licensed as a child care provider, but they're part of that after-school and summer world.
Okay, we will revisit the bill too. Okay, we all set with the legislation, Leon? Now I would like to move to the next item, part of the agenda for today, and it's about the Child Care Day celebration. And I like to just to revisit some of the things that was done prior to this meeting. The conversation during the last meeting was to figure it out, find out what was the best day the Capital TV can partner in with the Child Care Commission to be able to use all the resources Capital TV has in order to produce a good event that don't need to be necessary in person. Would be the combination of a lot of work from Capital TV by videotaping a little sip of activity from kids, artistic presentation, so many others. So Kendra Baron, Margie O'Brien, Osmari Baker, and Katie Neves and myself, we met 2 weeks ago to talking about brainstorming about how we can organize our, believe it or not, 10 years of child care celebration. That would deserve a clap, right? Because I can't believe it. Lisa, I can't believe we are working in the child care awareness day for 10 years. And I remember you struggled to keeping all the agencies, child care, business situated in the state household, providing snack for kids, getting kids count support in every single step of the celebration, making every year more successful and big event.
Very exciting. Yep, very exciting 10 years.
Yes. Fortunate, the COVID pandemic didn't stop the Child Care Commission, and we still celebrated addressing the limitations and the restrictions the Department of Health put in place. And we don't have a problem with that, but we are still celebrating 10 years of accomplishment. So we find out that Capital TV can help us on April 28th. That is correct, that is correct, right? And Kendra can also jump anytime and update the commission. Marjorie has amazing, for those who don't know who she is, Marjorie is the director of the Capital TV. She's in charge of production. All the events you see on TV on behalf of the State House and the Capital TV is produced organized and done by Marjorie O'Brien. So she's so talented, and she catch all the ideas we passed to her from the Child Care Commission. We wanted to put it together in an event where people don't feel boring, people feel engaging, people love it, and it also show all the things we accomplished for the last year. Little sip of some of the events where kids were engaging in activity in the State House with the members of the General Assembly. So many great things. And also, she was able to go some places, some child care centers to taping activity and incorporate it in the event. The amazing part, that excitement, and I want to share that with my colleague and all of you, is that we thinking it's the appropriate time to show the importance of child care, the the assistance we provide to the first responder workers for the COVID. So, in order those important individuals go to work in the hospital, paramedic, and other areas that are important for us, they need to have a child care. And we want to make connection between the importance of child care during the COVID pandemic and how the child care industry never stopped, never set back. If not, we are and be considered as a first respondent too, because we all the child care centers and home child care providers were there in the front line, helping and assisting doctors, nurse, paramedic, people who delivering our food. I'm get so emotional and so excited to think about that. Imagine is connecting the arrow from the need of child care to what we do and why it's so important to support child care in the state of Rhode Island. So I'm proud that we are all working in that. We will looking from you some feedback, some ideas, some contribution, because we want to bring fun and also bring consciousness of the importance of child care for Rhode Island move forward and move the economy again to the place we were before. So, Kendra, do you have anything to add to it? It's the
Chair
time.
Diaz, you just said it so beautifully. We were speaking about possibly having a theme of childcare makes the world go round. It's a possible thought and theme we were thinking as the overarching theme of this event, as well as highlighting all of the accomplishments of the Child Care Commission. But just to your point, Chair Diaz, what we really want to stress in this beautiful event is how essential childcare workers are. And not only in and of themselves essential, but essential to the essential workers that we've seen in COVID-19 with the pandemic, our food delivery people, our first responders, of course, nurses, doctors, EMTs, our postal workers, how childcare is so essential to them as well as essential in and of itself as a separate entity. So you just said it so beautifully, Chair Diaz, and it's going to be a beautiful event, a lot of pre-taped segments. I would encourage a lot of you to take a look at the Dr. Martin Luther King Jr. State Holiday event that happened this year. It operated in the same way with pre-taped segments, and Capital TV was instrumental in making that happen and carrying us from a seamless transition to a in-person event to a virtual event because of COVID-19. So it's going to be beautiful, and we're working hard on it. So thank you.
And we will keep the door open for those who want to participate during the process of organizing the event. If Senator DiMario or Rep Caldwell or any other members of the House wanted to be part of the process, I would like to see you ladies, because I'm not here forever and you will be in charge in 2023. So you need to exercise, now to get ready for the years coming. So with that in mind, I'm very excited. I will keep you update. I will send you update where we are and what we need. Especially Kendra will be connecting with you. We only away of the event around 40 days. So we have a lot of work in front of us. And hopefully we will make a beautiful event like we always do. Okay? Thank you. Kendra, what is the next in the agenda? I don't have it with me.
So forgive me, Chair Diaz, because I was having the technical issue.
Okay.
Did you happen to already do the agency report by chance, or?
No, it's that the next one. Now, I would like to introduce our co-chair from the Senate, Senator Alana DiMario. She will be leading us in the next two items part of the agenda for today. And Rep. Colwell, be ready because one of those days you will lead in the committee too. Okay, as I mentioned before, you and the senator need to be ready. So,
Excellent. The best, Chair.
Senator DiMario, you in charge. You're the chairwoman from now on to the end of the meeting.
Excellent. Thank you so much, Chairwoman. I hope everybody can hear me okay. I am coming to you from Rhode Island College before session, so hence the mask. So it's great to be back here with all of you, and I'd like to open it up for any agency reports or updates.
Come on, members, helping her.
I don't, unfortunately, have the ability to see if anybody has their hand raised, so I'm just going to welcome anybody to unmute themselves and give their update.
Lisa, is any update? You have to push a little hard. I will help you, Alana.
Okay.
Lisa, you have any update?
Start just calling out names if I need to.
Yes.
I can't think of any updates. The only small update I have is now that we have a date for Child Care Day, our agency will be working on an advocacy event for our child care programs. We weren't able to do that last year because of the switch over to virtual, and we just were a little behind the ball, but we definitely are planning something this year. More information to come on that. We'd love a way to kind of figure out how to engage our early childhood educators and our programs in some trainings so that they can be well equipped to do some advocacy for this commission in the future. So more to come on that.
Oh, Lisa, that night that you spoke, and excuse me, Senator DiMario, sometimes ideas come out. As you was in charge before to collect the names of the participants, I would like to asking you to help us to collect the names of the child care centers that want to be part of this event, and we can list it and acknowledge those businesses during the event. So at the end, we want to thank you to those places. Can you please help us to list it with a name, logo, the same way we did in the past?
Okay. Yeah, absolutely. I can coordinate that if you're interested. And so if anybody wants their agency represented in the program, let me know. And I'll reach out to Kendra and share my contact information and kind of a process so that we make sure we get everybody covered. Sounds good.
Similar to what we have done in the past.
Yep, absolutely.
Right. Any other agency updates?
Yeah, just share real quickly on behalf of the YMCAs in the state of Rhode Island. I've been hearing different numbers in terms of enrollment, and just so the commission knows that most of the YMCAs are right around 50% of their pre-COVID capacity. So it's still very much a rebounding situation for the state. We're definitely one of the larger providers, if not the largest provider. So right around 50%. I've heard some different stats all over the place, and I just thought it'd be good to share sort of where we're at as a collective group.
Thank you, Charlie. Oh, I'm sorry. Alana is in charge. I'm sorry.
Feel free to jump in anytime. And I think I saw somebody else.
Sorry, I skipped it.
Hi, everybody. I wanted to share a quick update from DHS. We recently launched a new consumer website in which providers can, childcare providers, both family childcare providers and centers can update profiles for their businesses, and it's open to the public, so families can search for childcare through this directory. It's accessible through the Exceed. It's kind of it's accessible through Exceed, in the Family Search tab, and it's taking the place of information that was previously available on the Exceed website, and then it can also be accessed through the Children's Cabinet website. But it's super exciting because it's a new, up-to-date space where the general public can search for childcare and see all the accessible providers they can access care with, and they can search for different age categories, the ratings of those childcare providers, and lots of other demographic information. So we're really happy about that.
That's fantastic. Thank you. Would you mind actually, if there's a direct link or just some information about that, could you maybe send that? I think maybe the best thing to do would be to send it maybe to Kendra, and then she could make sure to pass it along to the rest of us. That would be great.
Absolutely.
Thank you. Any other agency updates or reports?
I'll give an update. Hi. So I don't know if everybody knows, but our contract for family child care providers with the state was extended through December 2021. With that extension, there is a new technical assistance training for all CCAP providers starting April 1st, and that's going to be done through the ESF.
I'm sorry.
Working from home, I'm sorry. Sorry about that. So that is open, and I just wanted to make sure that people who know that ESF is the Education and Support Fund run through SEIU. So the other thing is I wanted to just formally thank Grace and Senator Cano for putting in the legislation that we discussed through earlier. We are really pushing hard for parent eligibility, and we want to make sure that that is something that is, obviously it's one of the top 3 priorities within the bill to the 225%. And we look forward to working.
Great. Thank you so much. And same thing, if you wanted to, Nicole, just pass that information along to Kendra so she can just include it in our updates. We have it as well. Thank you.
Of course, of course.
And can I could just give a quick heads up about, I think, the governor, our new governor, we have a new governor, is going to be putting his budget out, and we haven't really heard much, but he has a great opportunity because, the federal delegation got us $23.5 million, I think, for childcare in December, and the American Rescue Plan for Rhode Island is $93 million. So there is a lot of federal money coming in, and I'm seeing lots of other governors make announcements of great new things they're doing, including improving wages, expanding eligibility. So I'm excited. I think DHS probably can't, there's people in government necessarily can't always share things before the governor shares things. I don't know, but I'm excited to see, how that infusion of funding can improve our system and restore some of the, we were really seen as national leaders in the days of starting right with our high eligibility and our high rates. And so I'm excited about the possibility of that federal funding being used to make some permanent changes to our childcare system that would be good for everybody.
Absolutely.
I have a question, Chairwoman DiMario.
Yes.
Leanne, do you think we'll be able to find the good update information through the Senate Reid office to when those funds will be available now, or it's just waiting for the governor to update us in that? Because I want to have more sense of how we can have more access to funding for the legislation we have also, and for all the things that are so relevant.
I would ask DHS and the governor. I believe they're planning on giving an update on the plans for at least the money that was authorized in December.
Okay.
At a little bit later this month. So I think that you could ask them to share, and I don't have a lot of details, but I know that they worked on a plan, and the plan has been approved by the federal government. We were the first state to have an approved plan for that initial 23 million, and then the new money. Does anybody else, does Rachel or Lisa or Nicole or anybody know what the plan is for the American Rescue Plan money, the timeline?
I don't know what the timeline is for. I mean, it has to be to be signed into law first. We're jumping ahead a little bit, but it's not even approved yet. But I don't know if there's a timeline for that. It looks like Hannah came back on, so maybe she knows a little more.
Hannah, could you help us?
I was just going to speak to the CURSA funds that Leanne mentioned. I would say in like the next 2 weeks, there's going to be more information becoming available around DHS's plans for that funding. But I would be happy to bring that to the next meeting with like additional materials, or in advance of the next meeting, I can provide additional materials to the group if that would be helpful.
Chairwoman, can I ask a question in regards to funding?
Mario.
Oh, sorry, I didn't know which chairwoman she was referring to. Please go ahead, Senator.
I really appreciate it. I just have put in the chat that I received a letter saying that the Department of Human and Services have cut out for the budget of FY 2022 $1.3 million that are supposed to go to the Head Start programs that would impact our most vulnerable families and children. So I wanted just to, now that we have Hannah, and maybe Hannah doesn't have the answer to these, I wanted just to get some advice whether or not that is the truth, and are we expecting to see the cut of the funds of $1.3 million for the Head Start programs in Rhode Island? And we can get that information later on. I just think that it's important that we do plan as a commission, if you think that it's a priority, to make sure that we advocate for those funds not to be cut, since it goes specifically for children and families that need it the most. So,
may I say something, Chairwoman DeMario?
Yes.
Because unfortunately you came a few minutes late. We mentioned that, and we gave our good friend Mary Barr the opportunity to update. She didn't have any information, but the right question maybe can be posed to DHS, and they can help us next meeting or before to find out what part is true or not. Also, I mentioned that I will check with the fiscal analysis from Finance Committee that we don't know exactly what is in the budget that we have in front of us that was shared with the members last 2 weeks, I believe was. So I will emphasize, I made a note to find out that what we are in that. As you mentioned, we need to be prepared and ready to show that we need to keep those funding in the budget. Okay?
thank you so much. Really appreciate it. I'm sorry I missed that part.
No, it's okay.
Grace, can I say something? So any money that comes from these federal stimulus will be federal dollars. So that is not what the state has previously had for Head Start. So those are federal dollars. They wouldn't help us with our in-kind match. They're separate dollars. And yes, Head Start federally did get an increase for quality, for COLA and COVID relief as well, federally.
And I promise to update this information through Kendra, okay?
Thank you. Any other agency updates or reports? Any other communications or anything that you'd like the commission to know?
You have Laura Mason Saylor with a hands up.
Oh, okay, please go, unmute yourself and go right ahead.
So, I'm sorry I came in late. I had some technical difficulties. Was it mentioned that all childcare staff, et cetera, can get vaccinated now?
This is an excellent question. Oops,
No, I mean, I actually spoke to the Department of Health, and you do that through your local CVS.
Yes.
Call up to make your appointment for that. The other thing that I had a question, and this is something that I don't think we have the information yet, but the American Rescue Plan, I'm wondering if the heating and ventilation systems that are antiquated in some of the buildings that we use, if some of those monies can be used for that, because I know that that COVID is spread through the air, and we've had, like Charlie was talking about, having 50%. So with better HVAC systems, it also helps, in terms of reducing infection, et cetera. So I'm wondering if some of those monies might go through LISC, but I also worry because we have not, family child care has never been, for the past 20 years, has not been able to get monies for improvements to their physical spaces through this. And I think we need to figure out a way the family child care can make those things that make it healthier and safer. The other thing is reimbursement for to programs for all the monies that they've had to spend, the outlay for contamination, all of those kinds of things that they've had to do, the masks, etc. I also wanted just to give you some information about the bill around in-home workers. That is basically coming from the Civil War era, when whites did not want black workers to get fair wages. And so, part of the, that's why they were not included. And that's why, like, for example, the Center for Justice is supporting this bill, because they recognize that if you work in the home, does not mean you shouldn't be getting a fair wage.
Okay. Thank you so much, Laura. And please allow me to answer some of those questions, Chairwoman DiMario. It's too many questions, Laura, and I know you are so high energy and you put a lot of things to us to think about it. And I would love to ask you to put in the email for the Child Care Commission, and then we can analyze it to see how we can find solutions. Secondly, the second and the third question. I hope you remember that former Governor Gina Raimondo included article in the budget to helping child care centers and licensed home child care providers by providing grants to improve their facility. It was included in the bill, in the budget from 1920, I believe was. And I don't know if we still have funding from there to address those issues. And I know by personal experience, because I help a lot of providers to fill out the application. And 1199 lady, Nicole, maybe have more information about it, because I know 1199 was assisting home child care providers to apply for those grants that was available through Department of Human Services. The second question about equipment, about gloves and other things, also the Department of Human Services, or maybe the Department of Health, was providing PPE to every home child care providers. At the city level in Providence, I personally distribute gloves and a mask to providers in order to follow the Department of Health policies. So those two things was addressed when the pandemic was at the highest level in Rhode Island. If we still have those needs, as I mentioned before, please place those requests in the email, and I will personally working with Department of Health and Department of Human Services to see if we still have some availability of funding, or figure it out how we can help with a new stimulus package that coming to Rhode Island. Okay? Sorry, I don't intervene no more, Chairwoman DiMario.
No, that is great. You are the keeper of all of this information, so I really appreciate you jumping in and giving those responses. Thank you.
Chairwoman, this is Rachel Flama. I'm sorry I'm not on video, but I was wondering if we could ask Hannah and DHS for an update on the market rate survey. my understanding is that that's happening soon.
Okay, it's a fair question. Chandra, can you please post that and we can talk?
I can give a quick update if that would be helpful.
Hannah, I appreciate the intention, but I promise the members always finish on time. We have 2 more minutes to finish, and then we have session two. Rep Powell and myself, we need to go to the State House. So I appreciate that. If you want to send it through our policy lady, will be awesome. That way the members can have the information.
You guys gave me some homework. I will definitely circulate some materials.
Thank you.
Yeah.
So if there is no other business, I'd like to make a motion to adjourn.
Any motion, members?
So moved. I move to terminate the meeting.
And second?
Second.
All right.
So,
Thank you. I'll see you next time.
Thank you. See you soon. You will have information.